My name is Shah, and I am the state representative for District 24, which is Central Phoenix and South Scottsdale. I am also an emergency physician and have been practicing pretty much continuously for about 15 years in medicine. So that's been.
Sure, my name's Walter Morell. I'm the CEO here at Native Health. I've been with Native Health for a little over 20 years, and as CEO for about 10 years. We're a HRSA-funded community health center as well as an IHS-funded urban Indian health program. We have a clinic in near Metro Center, one here in Central Phoenix at Central and Indian School, and another one in Mesa at Southern and Extension. And we offer primary care, behavioral health, dental care, as well as WIC and other social determinant programs to assist our members of our community. And there's a broad range of services that we provide, but I'll skip those and move forward with Dr. Dunnigan.
Thank you. Hi, I'm Diana Dunnigan. I'm the medical director here at Native Health, and I've been here for almost 2 years. I'm a practicing pediatrician. I've been in practice for 18 years, experience in Indian Health Service prior to coming to Native Health.
Fantastic.
Hi, I'm Deanna Sangster. I'm the Health Services Administrator for Native Health. I've been here for, 25 plus years. So I oversee the medical and dental clinics at all of the locations and work very closely with Dr. Dunnigan as the medical director.
Well, we received your questions in advance, so maybe we'll just work on answering those. I know your first question was about some of the challenges faced by urban Indian communities. I think Dr. Dunnigan can speak to the clinical and those that present there, but we've had I think some of our challenges that we traditionally have are those of isolation and a lack of really understanding of our community on how to navigate the sort of open market health system that exists in the city, coming off of from reservations or other communities, and knowing to access Indian Health Service seems like a natural. But when you move to the city, that there's sort of a disconnect there. I know we do have Phoenix Indian Medical Center, but during this crisis time, those services are cut back quite a bit, with some of their specialty care clinics closed and some other things. So we're trying to remain open to our normal regular visits, office visits, and this Saturday we just had a pediatric day clinic. And so, I think as we're facing things, the isolation from family members back on the reservation is an issue. The natural isolation they feel within the city with things not targeted specifically for that population can be a problem. And like any other Indian health organization or clinic, we face the issue of the danger, the heightened anxiety of having such chronic illnesses, and you read the news and say that those chronic illnesses such as diabetes or hypertension exacerbate or they have more severe reactions or from the coronavirus. That creates an even higher level of anxiety, and then I think it just magnifies those things that we're already dealing with in our behavioral health department. For example, our request for DV intervention has gone up threefold since the crisis began. So we're facing the same issues in terms of shortfall of public health issues, only they seem to be magnified by the coronavirus. So I don't know, Dr. Dunnigan, I think any challenges facing our population that you see?
Yeah, I would agree with you, Walter. I think a big part of it is the propensity towards chronic disease. So higher level of diabetes, heart disease, those are the main risk factors that we see with COVID. And then we're making such a push towards virtual visits, so telephonic visits and telehealth visits, and not all of our patients are comfortable with that modality of communication with their provider. Not everyone has the setup that's needed, so the technology at home, or they're not quite as comfortable with it. So we're meeting that challenge too. And then the fear about what's going on with their family who's a little bit more remote, and especially in the Navajo area. We're seeing some of that with our staff as well. People have very sick family members and what that means to them.
One of the other things I might know, I know we don't have our behavioral health specialists here, but early on, before we were able to do telecommute, and that it's our telehealth, one of the struggles we had in behavioral health is some of the groups. I think the loosening of standards, or not loosening of standards, but access or CMS allowing us to expand telehealth visits into telephone, voice only, as well as video, has been a real kind of a blessing during this time when people are not wanting to intermingle in the population, especially when you think about a clinic intermingling with the sick population. But initially the reservations about coming were very, very foremost in people's minds. But in some cases, initially, and I want to say initially because I know we've only been kind of in this mode for 5 or 6 weeks, but it seems like a very long time, was we had some questions from on the behavioral health side. Some of our groups are court ordered, and so they were worried that they had to come in, and then the groups were canceled, and they had an obligation to the court to finish their groups, whether this was substance abuse or domestic violence or anger management. That became a difficulty. They continued, the courts continued to require that of those people, and now that we have gone to the telephone visit, we've had a better show rate than initially. But those are two things that have helped that group of people, and in behavioral health. So there have been some, I don't know, some things that lag behind in terms of accommodation for our patients. But as time goes on, it seems like the state and the federal government, and then even our services, have become much more nimble in the ability to meet those needs, or at least the attempt to. So in terms of, I know your other question was coping. I'm not sure that maybe Dr. Dunnigan has had more patient contact than I have. As how are our patients coping with the coronavirus environment we have now?
I'm not seeing a lot of fear from our patients. And I take care of the children, and they're not terribly bored being at home from school, but it is challenging. I don't see more of a challenge than I see in the rest of the population, other than the fear that people have about what's going on in the reservation. That's my personal experience.
The fact you practice pediatrics, so I'm assuming that you're not seeing any real serious cases among the children. I mean, everything we've read about COVID is that it's pretty much spared everybody under 20.
We haven't seen any confirmed cases of COVID in the children that we've seen at all. We've had 3 positive cases in our organization, and they've all been in adults. Mm-hmm. And none of those patients were extremely ill. So.
Yeah. I mean, I think Arizona has an experience which is different from many of the other states that are out there. If you look at New York, New Jersey, of course, and Connecticut, that tri-state area has been hit really hard. Out here, very different. It has to do with some of the way we live out here, is that we're physically spaced apart compared to people living on top of each other over there. So, it makes a difference. We also kind of were a couple weeks behind. I know we had a case here real early, but that was sort of quarantined off, and then we just were not as international a city as say New York, LA, San Fran, some of these other places, right? So with the volume of traffic being a little bit less here, we had a little bit of a run-up time where we didn't really see a whole lot of cases, and then started to move up, and now we're kind of at the plateau, as far as numbers go. So I personally think Arizonans have done a really good job. The fact that we have our if you look at the number of cases per 1 million population, excluding Navajo Nation, which is a hotspot, excluding Navajo Nation, the rest of Arizona has been okay. When I say okay, I mean, still 250 people have died from it, but let's just say it could have been much worse without the social distancing, without the measures that we took pretty appropriately in order to get it to where it needs to be. And now we just sort of need to finish dealing with this virus and manage the back end of the curve. So those are the kinds of things I work on. Again, I'm a member of the legislature. I don't have a whole lot of influence into this because the legislature, what we really do is we allocate money. And we already did. We gave the governor about $105 million, 50 million for public health, 55 million for economic recovery. And then it's really all in the hands of the executive branch in terms of what they want to do and how they want to run it. And they have been. And pretty much I have very few complaints about the way they've been handling it so far. So that's good. And now I think everybody's kind of anticipating, as you start to see on the news, the public conversation kind of changing, maybe like, are we going to reopen? When are we going to reopen? And what is that going to look like? And I think that we want to. I think on behalf of the medical professionals, I can't speak for them, but the Arizona Medical Association, the Nurses Association, we're focused on following science.
Yeah, I think so, and I'm not certain from an administrative perspective that I'm entirely comfortable in paralleling the opening, the society that we may well need to have for economic activity. However, I don't know that much is known as to whether or not will it follow the flu trajectory and come back in the fall, and what will that mean for us? And then facing the same issues that we faced at the beginning of this pandemic, like the lack of testing supply was a real issue for us early on, and the struggle we have in acquiring PPE, from this source and that source, and that became a little bit of a difficulty in that at first the stuff was managed through the state, and then it was managed through the counties, and then trying to develop a direct source, and then it's all commandeered by FEMA. So we had a real problem out here in the field and getting the tests and getting some of the PPE that we needed to do to guarantee that we could continue our operations. So that was an issue. And I think that, if this does recur or come back or flare up in the flu season, in the winter, in the fall, then will we be prepared, and what have we learned now that we can do, to prepare for that? I think that's an important question from the public health perspective as to what we need to do to be guarded and cautious about opening up again. And at the same time, we have to protect our providers and protect the element of recruiting providers.
I think the key piece of that I've sort of been pushing for. I spoke to all of our federal reps earlier today on a Zoom call just like this, as well as Senator Sinema was on a call for us for a few minutes. And the thing that we pushed was that we've got to have some federal money coming in to think about track, trace, totally isolate, and test. And if we can do those things, we can take the disease and surgically remove it, to use an analogy, from society, rather than what we're doing now, which is the hammer. Hammer and lock it. Hammer is a lot of collateral damage, and by that I mean people really need. I mean, we do want to reopen at some point once we have the race. To me, it's making sure that we have such infrastructure to little outbreaks as they happen, because they're going to happen. Find them, contain them, move on. Find them, contain them, move on. That's what we're going to need to do as we kind of live with this for the next months to a couple of years. So I'm pushing for that to be in place, and that piece will hopefully get us back to a place where we have some public confidence in terms of going out and doing business and interacting with others, and knowing that we've got the risk of this thing down to a real minimum.
Right. I think the key to that, from our perspective, really is the wide availability of testing. There's an event coming up sponsored by ADHS this weekend that we'd like to be a part of, but then it becomes, again, limitation of supplies. We were told by Indian Health Service that we would be able to get equipment, tents, and air conditioners from them, but then they said no, and we had to refer back to the state, and so we worked with the state. So we're a little bit behind the curve from confusing directives from the various folks, whether it's the state or the county, Indian Health Service. We're not wanting to be behind the curve, but or behind an 8 ball, really, but we find ourselves, you know, at the bottom of the PPE and equipment hierarchy, and that's really unfortunate because we find ourselves also at the same time on the front line of taking care of patients. And I think the key to opening up and some assurity to the population would be the widespread availability of testing. And we're just not seeing that right now. I mean, if the widespread availability of testing is supposed to happen at your point of care, it would seem like we would be involved in some conversations, which we don't seem to be a part of.
Yeah.
So any thoughts, Dr. Dunnigan or Deanna?
I don't really have anything to add to that, to be honest. I think that was well said.
So any help you can give us in remembering that, you know, I think the key to getting us out of this and getting sort of as back to normal as whatever the new normal is going to be for a while until maybe there's a vaccination. I think testing is the key, and I think getting it as fast as we can to the general population is really what we'd hope we would focus on. And as we're planning for a post-COVID, post-emergency or crisis environment.
I spoke with someone today. I haven't been in touch with results frequently, and in touch with the concerns and let you guys are doing and that you're contributing, and that we need to think about all of our stakeholders that specifically deal with every relation that's out there, and that nobody can get left behind.
Great. We appreciate your support and your advocacy.
Absolutely, yeah. You guys have my hopefully Erica can distribute my info. If there's anything else that you guys more specifically need, please don't hesitate to reach out. I'm sure you've received same kinds of offers from some of our other representatives. The ones you mentioned anyway, I love working with. I think they're wonderful, and so it's heartening to see that many of us can come together during a difficult time.
Great. We've always enjoyed the support of our elected leaders from the state. You know, Senator Alston is still there, and in better times, we'd invite you down for a tour. So maybe when things clear up, that can happen.
Absolutely, yeah. I mean, I've toured many of the organizations in and around our district. I know Circle the City is in my district. Mission of Mercy is in my district, or used to be. I don't know where they're moving now. Just outside the district is the Human Services Campus run by Miss Schwabenländer. And so happy to come down and you know, see what you guys are up to and how we can be of service.
Great. Thank you.
Awesome.
Thank you.
No problem. Thank you guys for setting up the call, Erica. And yeah, please let me know if there's anything else I can do.